40 PANCE Practice Questions Antibiotics with Answers and Explanations Part 2. Hello, welcome to the Science Guide ASAP Learning. Today, we are going to be practicing 40 PANCE style questions. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 11. A patient is prescribed an antibiotic that has a half-life of 24 hours. After 48 hours of treatment, what percentage of the drug is expected to remain in the patient's body? A. 12.5%, B. 25%, circa 50%, D. 75%. Answer, A. 12.5%. Explanation. After 48 hours, 2 half-lives have elapsed, and thus, 25% of the drug remains in the body, 50% after one half-life and 25% after the second half-life. Question 12. A patient is prescribed an antibiotic that has a volume of distribution of 0.5 L per kilogram. If the patient's weight is 70 kilograms, what is the total volume of distribution of the drug in the patient's body? A. 35 L, B. 50 L, circa 70 L, D. 140 L. Answer, circa 70 L. Explanation. The total volume of distribution can be calculated by multiplying the volume of distribution per kilogram of body weight by the patient's actual weight. Thus, 0.5 L per kilogram times 70 kilograms equals 35 L. Question 13. A 32-year-old female presents to the emergency department with a sore throat and fever for the past 2 days. On examination, her tonsils are erythematous with exudate, and her posterior cervical lymph nodes are tender. Rapid streptococcal antigen test is positive. Which antibiotic would be the best first-line treatment for this patient? A. Penicillin V.B. Azithromycin, circa ceftriaxone, D. Amoxicillin. Answer, D. Amoxicillin is the first-line antibiotic for the treatment of streptococcal pharyngitis. Penicillin V is an alternative for patients with a penicillin allergy. Azithromycin or clarithromycin can be used in patients who cannot tolerate first-line agents, but they should not be used as first-line treatment due to increasing resistance. Question 14. A 65-year-old male with a history of diabetes and chronic obstructive pulmonary disease, COPD, presents with fever, cough, and increased sputum production for the past 5 days. Chest X-ray shows infiltrates. Sputum culture grows Streptococcus pneumoniae. Which antibiotic would be the best choice for this patient? A. Trimethoprim sulfamethoxazole, B. Ciprofloxacin, circa amoxicillin clavulanate, D. Ceftriaxone. Answer, C. Amoxicillin clavulanate is the first-line antibiotic for the treatment of community-acquired pneumonia in patients with comorbidities such as diabetes or COPD. Trimethoprim sulfamethoxazole is not effective against S. pneumoniae. Ciprofloxacin is a second-line agent that can be used in patients with penicillin allergy or treatment failure. Ceftriaxone can be used in hospitalized patients. Question 15. A 28-year-old female with a history of recurrent urinary tract infections presents with dysuria, frequency, and urgency. Urinalysis shows pyuria and positive nitrite. Which antibiotic would be the best choice for empiric treatment? A. Ciprofloxacin, B. Amoxicillin, circa trimethoprim sulfamethoxazole, D. Doxycycline. Answer, C. Trimethoprim sulfamethoxazole is the first-line empiric antibiotic for the treatment of uncomplicated urinary tract infections in women. Ciprofloxacin and doxycycline are alternatives for patients with penicillin allergy or treatment failure. Amoxicillin is not effective against the most common uropathogens. Question 16. A 45-year-old male presents with a skin infection on his leg. The area is erythematous, warm, and tender. There is no purulent drainage. Which antibiotic would be the best choice for empiric treatment? A. Cephalexin, B. Vancomycin, circa azithromycin, D. Levofloxacin. Answer, cephalexin is the first-line empiric antibiotic for the treatment of uncomplicated skin and soft tissue infections. Vancomycin is reserved for severe infections or patients with a penicillin allergy. Azithromycin or levofloxacin can be used for patients who cannot tolerate first-line agents, but they should not be used as first-line treatment due to increasing resistance. Question 17. A 24-year-old female presents with a history of recurrent urinary tract infections. She is diagnosed with acute pyelonephritis and started on oral antibiotics. Which of the following antibiotics should be avoided in this patient? A. Trimethoprim sulfamethoxazole, B. Ciprofloxacin, C. Amoxicillin clavulanate, D. Nitrofurantoin. Answer, A. Trimethoprim sulfamethoxazole. Explanation. Trimethoprim sulfamethoxazole should be avoided in patients with a history of recurrent UTIs due to the high likelihood of resistance. Ciprofloxacin and amoxicillin clavulanate are appropriate choices for treating acute pyelonephritis. Nitrofurantoin is effective for treating lower UTIs, but not for pyelonephritis. Question 18. A 32-year-old male presents to the emergency department with a deep-seated skin abscess. The abscess is drained and the culture shows methicillin-resistant Staphylococcus aureus, MRSA. Which of the following antibiotics is the best choice for this patient? A. Ceftriaxone B. Amoxicillin C. Vancomycin D. Clindamycin. Answer, C. Vancomycin. Explanation. MRSA is resistant to most beta-lactam antibiotics, such as ceftriaxone and amoxicillin. Vancomycin is the drug of choice for treating MRSA infections. Clindamycin is an alternative agent for treating MRSA infections, but may have increased resistance rates in some regions. Question 19. A patient presents with a bacterial infection and is started on a medication that inhibits cell wall synthesis by binding to penicillin-binding proteins. Which of the following antibiotics has this mechanism of action? A. Vancomycin B. Ciprofloxacin C. Azithromycin D. Amoxicillin. Answer, D. Amoxicillin. Explanation. Amoxicillin is a beta-lactam antibiotic that works by binding to penicillin-binding proteins and inhibiting cell wall synthesis. This leads to bacterial cell death. Question 20. A patient with a bacterial infection is started on a medication that inhibits protein synthesis by binding to the 50S subunit of the bacterial ribosome. Which of the following antibiotics has this mechanism of action? A. Cephalexin B. Azithromycin C. Ciprofloxacin D. Penicillin. Answer, B. Azithromycin. Explanation. Azithromycin is a macrolide antibiotic that works by binding to the 50S subunit of the bacterial ribosome and inhibiting protein synthesis. This leads to bacterial cell death. Please like and subscribe for more videos like this one. Make sure to watch part 3.